Good morning, everybody, and thanks for joining us this morning. This is day number 7 of the government shutdown. I'm disappointed, horribly disappointed the government was shut down and that it's still shut down. I thought it would be good to talk to the Kansas press myself and try to answer some of your questions if you had any. I thought number one, we would talk about what's our goal here? What's the Republican goals right now? So number one, it was to keep the government open. And number two is to work towards responsible spending. To work towards responsible spending, the backdrop that a nation that's $37 trillion in national debt, we're going to spend $1 trillion this year on interest. The government's going to take in $5 trillion but spend $7 trillion this year. So I think that's the backdrop to us as Republicans. We want to keep the government open, but we also need responsible spending levels as well. I think the next thing that I feel like some of my folks back home and the national media is not spending enough time is understanding the process that it takes 60 votes in the Senate to pass something. So just because Republicans have the White House, the House of Representatives, and the Senate doesn't mean we can pass spending legislation. It takes 60 votes in the Senate to pass this. We have 53 Republican senators, so we'll need at least 7, probably 8 Democrats to be able to pass this. I want to remind folks that over the last 4 years with Joe Biden as president, over 12 times Republicans walked across the aisle, walked the plank, and voted similarly for a stopgap resolution to keep the government funding open. So over a dozen times in those 4 years. I think next I would just mention that I feel like this is a political shutdown, and that's why it's so hard to predict when it's going to end. I know there's some smoke screens out there, some thoughts about policies, but I think mainly that this is a smoke screen. Our Appropriations Committee, made up of Republicans and Democrats, are making great progress, the fastest progress we've made up here in decades. They had 90% of the spending levels done through the appropriations process, through the committee, ready to bring to the floor. But Senator Schumer has clogged that process up. And it wasn't, why I think this is political, that it wasn't until 14 days out from the government shutdown date that Senator Schumer told us what his demands were. Those demands included spending another $1.5 trillion in addition to working with these, extending the COVID subsidies as well for the ACA. So I don't think that that's a serious person. I believe he wanted to shut the government down all along. That back in the spring when they did a stopgap measure, that he caught a lot of grief from his far liberal left and the national media as well for not fighting back harder against President Trump's policies. So it's my belief that no matter what was going to happen, Senator Schumer wanted to shut the government down to prove to his left flank that he was fighting. And yes, he could be threatened in a primary by AOC, and she's leading this charge that we need to do something over here. So this was their response to doing something to fight back against President Trump. So I believe that this is a political shutdown. Waiting for 14 days to say you wanted to extend these extended COVID subsidies isn't realistic. And we'll talk about specifically why that's not serious as well. These are kind of deep subjects, and I wish I could make it even simpler, but I want to emphasize what they're talking about are COVID subsidies, not the original ACA subsidies. The ACA subsidies for people enrolled in the Affordable Care Act, that those are going to continue no matter what happens. But also no matter what happens up here, I think everyone realizes that the Affordable Care Act is not affordable. The Affordable Care Act is not affordable. Insurance premiums are going to go up 18 to 20% next year. Again, regardless of what Congress does, premiums are going to go up 18 to 20%. The country is now spending 18% of its GDP on healthcare right now. That's went from 13% a couple of decades ago to 18% of GDP. Insurance costs have went up 400% over the past couple of decades. Health insurance has led inflation for all practical purposes as well. So the real problem here when it comes to these ACA subsidies, the COVID subsidies, is the cost of healthcare. And just want to communicate, you heard President Trump say yesterday, and I'm going to repeat it today, that I want to fix healthcare, specifically the cost of healthcare. That's one of the reasons I came up here as much as anything. I think I'm the only member of Congress that's ran a hospital. And I think that brings some unique experience. I'm the only member of Congress that's oversaw 3 county health departments, along with running my own practice. So I understand healthcare forward and backwards. And I think that there's solutions out there. But the real elephant in the room is the cost of healthcare, that premiums are continuing to go up regardless. When it comes to these COVID subsidies, the way that they've been set up has led to a lot of fraud. We think that there's $25 to $50 billion a year in fraud from these subsidies. And I think if you would ask Kansans, do you think that we should fix this program or allow it to continue as is? And it's complicated to fix the fraud. Even if someone said, look, Roger, how would you do it right now? It would probably take a couple weeks to a month to negotiate with my friends across the aisle on how to fix the fraud issue. That alone, I think, would say, why did Chuck Schumer wait till 2 weeks before the government was going to shut down to say, oh, he wanted to work on this? So the real problems with these COVID subsidies, which the Democrats voted on and passed without any Republican votes 4 or 5 years ago, they set a sunset date on these the end of this year. Just like all the other COVID subsidies, this was supposed to go down as well. So we're not ending the ACA subsidies, the traditional ones. What we're trying to figure out is what to do with these special COVID era subsidies that are allowing people making $200,000 a year to still have their health insurance subsidized by the federal government. And again, I want everyone to have access to health care. It's one of my pillars for MAHA. So that's the main reason they're telling us they want to shut down the government. There's some other ones and there's some other issues. But I think I wanted to stop there and go to some questions. But that's the main issue, is these ACA COVID extended subsidies, these enhanced subsidies. So we're going to go to questions, and we've got a special guest on the Zoom here with us that we wanted to let ask the first question, and her name is Caroline Bill. Caroline is at Shawnee Mission East High School, and she asked to interview us. So we said, well, just join us for this press conference, and we'll let you have the first question. Do we need to unmute her?
No, yes, I'm here. Thank you so much for taking the time to speak with me. Senator, my first question is, in the interest in resolving the shutdown quickly, could you outline what specific compromises your party is proposing? And then on the other hand, what concessions would you be willing to consider from across the aisle to reach a bipartisan agreement?
Right. So I think that to some extent there's apples and oranges here. To us, the government funding issue, keeping the government funded, shouldn't have any strings attached to it. What history has shown is whatever party, when there's a shutdown, whichever party is fighting to add a new policy to, is the one that ends up losing this. So we think that adding any policies right now is not a good idea. But I'm very willing to go down any of these other rabbit holes with the Democrats. Whatever they want to work on, we're very willing to do it. And those conversations are happening. Whether it's fixing these COVID era enhanced subsidies or not is one of the big issues. So I'm very willing to try to fix healthcare. And if you look at our agenda for the healthcare committee I'm on, we're trying to do that. We're trying to impact the cost of healthcare. That's really what we should be focused on. But when there's a shutdown, we can't do it. If you think about the package of bills that we've been working on for years to bring down the cost of healthcare, our signature bill is actually a price tags bill, where before you have the surgery done, before you have an MRI done, each facility should tell you the price of that, what it's going to cost. as well as outcomes. So that's our signature bill. We've been working on this for 7 years. I think we can get it across the finish line. When there's transparency, that allows patients to become consumers again and then choose where they want to have their x-ray done or where they want to have their surgery done. Another big issue we're fighting to bring the cost of healthcare down is prescription drug work. Now, President Trump announced his Trump RX, happy to dive into that. But what we're trying to do is trim back the pharmacy benefit managers. And again, some of our signature legislation is to break them up. There's 3 pharmacy benefit managers. They control 90% of the market. These are all 3 in the top 50. All 3 of these companies are in the top 15 of the Fortune 100 list. As well, and then expanding healthcare savings accounts. So I'm very willing and have worked, and all this legislation I've talked about has bipartisan support. So there's Democrats that have co-sponsored the bills. With us, we helped write them together. So I think that's where the focus should be. If that's the hang up here is the cost of healthcare, by all means, I want to embrace it and fix it. Carolyn, I'll give you a follow-up. Did I answer your question? Is there anything other part of it I didn't ask?
No, that was great. Thank you so much.
Yeah, thanks for joining us, and we wish you well on your career as a budding journalist, and look forward to reading your article.
Yes, thank you so much.
You bet. So next we're going to Capitol Journal. Is it Jack? Jack, at the Capitol Journal, you should be live. Go ahead.
Hi, Senator. You mentioned fraud in the expanded subsidies. I wanted to just ask if you can point me to any evidence of that. Yeah.
I will. And I think that you can go to the Paragon Health Institute website. And what it amounts to is, as I understand it, and even there was a new suit in Florida, we'll try to get that from Rick Scott, something is cooking as well, is if a person that sells health insurance, all they would need is your name and your birth date, and they could sign you up for these ACA zero premiums. And that's the ticker here, is that there's zero premiums because of these COVID era subsidies for people making less than 200% poverty level. So they're signing up people that don't even know they're being signed up because there's no premium. And what they've found is a significant number of those people are not even using their health insurance. So you look at their claims data and they're signed up for the ACA, but I think it's almost like a third of them that are signed up for the ACA in these lower income brackets are never using their health insurance. Why? Because they don't know it. And so you look at the overall, these subsidies cost about $35 to $40 billion a year. Again, this is just the COVID era subsidies. It's $35 to $40 billion a year. All total with the original ACA, it's about $150 billion a year. So we think in those COVID era subsidies, all these people that are paying zero per month, that there's a lot of fraud in there. And we can try to send you some more information as well on some of my sources. Okay, let's go to Andrew from the great city of Great Bend Tribune. Andrew, go ahead.
Hi, how are you doing, Senator?
Great.
So just a quick Google search said that healthcare costs in the U.S. have increased from 1970 at $350 to today. Estimates are over 14,000. And also the U.S. spends the most per capita in the world on healthcare. Why have the costs increased so much in the past 50 years?
Yeah, and that's certainly why I came to Washington, is try to fix it. I think number one is the Affordable Care Act. The Affordable Care Act took nurses out of our hospital on the floor. We had to turn them into data entry people. It's turned doctors into data entry people. That there are so many rules that's led to consolidation in the industry. And this is true in banking as well. So more and more, because of the Affordable Care Act, small hospitals cannot keep up with the regulations. Small insurance companies can't keep up with the regulations. So it's allowed hospital systems to consolidate and insurance companies to consolidate. You look across the state of Kansas and you've got 2 or 3 health insurance carriers, so there's lack of competition, and more so, a handful of big, hospital systems as well. Now they're national hospital systems ruling the day as well. So I would say that is number one. And I think numbers 2 and 3, let's think about my pillars for driving down the cost of healthcare: added transparency, promoting innovation, and turning patients back into consumers. So by allowing the opaque system we have, can you imagine going to a restaurant and never knowing what the prices are going to be before you order, or going to look at cars and you go to my good friend the Marmies there, and you have no idea what the cost of a new Dodge Ram truck is going to be, and then you could go down and look and see, well, how much is the Chevy truck going to be, and make that decision. It allowed the healthcare systems to get away with this opaqueness, a lack of transparency. When a patient would come to me, excuse me, and ask me, I told them, well, look, you need to have a surgery done. They wouldn't ask me what it costs. They would ask me, well, will my insurance cover it? I think we need to get out of that mindset and let patients become consumers again. So I think that's the tip of the iceberg. Is overregulation has led to consolidation of industry, a lack of competition. The other thing that I haven't talked about is that America's sick. Okay, Bernie Sanders and I have this conversation all the time. Why are healthcare costs going up? As well, because America is a very sick nation right now. 70% of Americans have a chronic disease. And 90% of the dollars we spend on healthcare are spent on those chronic diseases. Think about hypertension, heart disease, diabetes, obesity, Alzheimer's, cancer, and mental health. My goodness, what we're spending on mental health right now. We have an absolute mental health epidemic challenge in our country, especially our youth. So as our country has become obese, and developed all these chronic medical problems, it's driving up the cost as well. Why are we having so many people needing hips replaced and joints replaced at younger ages? Well, because of their obesity, because of their lack of activity, they're wearing those joints down much quicker as well. So America has a health problem, and I don't want to bore everybody, but I'd love to go into what our MAHA agenda is as well, but we probably better go to the next question.
Thank you.
State Journal.
Brad from Sunflower Journal.
Yeah.
Brad, go ahead.
Good morning, Senator. Next month, the open enrollment's going to start for the ACA exchanges, and a lot of Kansans and a lot of people across the country are going to start getting bills showing how much their insurance is going to go up, exacerbated by the loss of the enhanced premium tax credit. I guess my question for you and the rest of your party is, what do you think the political repercussions are going to be of that once people start getting these bills and opening them next month and seeing how much their insurance is going to go up? And I'm just kind of curious about your response to that.
Yeah, well, this is nothing new, right? Again, those insurance rates are going to go up 20% regardless. I've thrown out solutions to help bring down the cost of healthcare right now. So I think the political repercussions is it's going to drive us maybe to get some of my legislation across the finish line. But I'm very concerned about it, right? But I think we need to be realistic here. That the people that are making under 200% poverty level, 200% of poverty level, so that's going to put it at $60,000 a year for a family. Their premiums are going to go from $0 to like $10 or $20 a week. Okay, is that reasonable to ask them to do that? So even if these advanced premiums go away, these COVID era premiums go away, the federal government's still going to be paying 80% of their premiums, right? Rather than the 90% on average as well. But I'm following the situation real closely. I think we need to address the elephant in the room, which is the cost of healthcare. And again, all this bipartisan work I've done, it's time for it to come to fruition. It's time for us to pass our legislation, our transparency, our price tags bill, our bills on expanding HSAs, along with putting the pharmacy benefit managers back in their box. Pharmacy benefit managers are taking 50 to 70% of every dollar being spent on prescription drugs, and they are the cause of why community pharmacists are closing across the state as well. Okay, we go to Matt Kelly from the KC Star. Matt, go ahead.
Hey, good morning, Senator. I have a few questions, but I was curious, have you spoken with President Trump about the situation with the Eisenhower sword and the museum library director about whether or not it's appropriate for him to have lost his job?
Yeah, none at all. I was not even aware of this story until I read something Sunday about it. And I don't know if it was your publication. So I knew nothing of it. I doubt President Trump knew anything about this sword either. But
gotcha. Fair enough. And then I'm curious, why do you believe Laura Kelly doesn't want to hand over the personal information of Kansas SNAP beneficiaries to USDA? And how worried are you about the ongoing federal funding for SNAP in Kansas?
Yeah, I have no idea. I don't want to guess. I'm very concerned that Kansas has not done a good job running the SNAP program. We've become less and less efficient. Our failure rate is going up and up as well. You'll have to ask her that question.
Jack has a follow-up question from the
All right,
Capitol
Jack,
Journal.
we're going back to the Cap Journal.
Thank you, Senator. Yeah, I've seen Democrats focus a lot on these ACA subsidies, but did want to ask broadly about other demands that they have. I've seen some other things that they're seeking in these negotiations, so just wanted to ask
Can you be
about it.
more specific?
I've seen them. I've seen some things about reversing Medicaid cuts from the One Big Beautiful Bill Act, and I've seen some about presidential impoundment of congressionally appropriated funds.
Great, great. Okay, that's very helpful. So part of Senator Schumer's negotiations is he wanted to basically end the One Big Beautiful Bill, all the great work we got done there. That he wanted to end, he wanted to take back the $50 billion Rural Health Transformation Fund that was really my dream, something I've been working on since New Year's Eve with Dr. Oz on. So they say they want to help rural healthcare, but they're going to take that back, which is really, I think, rich. So that would be one thing. And then also within the Big Beautiful Bill, we closed loopholes so illegal migrants couldn't get federally funded health care. The CBO, Congressional Budget Office, not Roger Marshall, estimated that our One Big Beautiful Bill would have closed loopholes about 2 million illegal immigrants that were getting health care. So they wanted to claw that back as well and open those loopholes back as well. So I think within the context of that $1.5 trillion that they were asking for to spend more money on, the money for illegal aliens health care, I think was a big piece of that as well. So those were a couple issues I think that I would address. I'm looking through some of my notes as well. So we talked about healthcare to illegals. Let's talk about rural healthcare just a little bit more. I think that's really, obviously that's so important to me. As you all know, hundreds of rural hospitals are closing. And this is unfortunately nothing new. Any hospital that's closing today, next month, next year is on the back of Democrat healthcare policy. The ACA has been the law of the land now for some 15 years. The policies that we passed in the One Big Beautiful Bill won't really amount to anything for a year or two. And at the same time, we've added the $50 billion for the Rural Health Transformation Fund. And we went out and got almost $1 billion of new funding, new Medicaid funding through the provider tax. Again, this is funds that I went and firstly fought for. So that's going to be potentially $1 billion of increased revenue for Medicaid hospitals over the next couple of years. Billions of dollars when you put them all together. So for the Democrats to suddenly wake up and say, gosh, we're concerned about rural hospitals, I don't understand that. 97% of rural counties voted for President Trump. Democrats, frankly, have never cared much about rural America because they vote Republican. So I don't know why they're trying to hide behind rural hospitals. Remember, the underlying factor, problem, challenge for rural hospitals is the decrease in populations. A lot of these counties have lost 30, 50, 60% of their population over the last several decades. So they struggle with their number of people, and then the economy struggles as well. That those hospitals are a reflection of the rural economy. So again, let's go back to the real problem here. What can we do to improve the economies in rural America has always been one of my focuses. That'll help the local hospitals stay afloat. But just to put an explanation point on the struggles for these rural hospitals right now is 60% of the critical access hospitals are underwater to the tune of $600,000 a year. Their average census is 1.8. These hospitals losing money, their average census is 1.8. They have at least 25 beds. So could you imagine having a 25-bed hotel you're trying to run, but you only have average 2 people a day? You can't do it. So that's why we need to get this rural health transformation grant right. That we need people with experience in rural healthcare writing the grant process to make sure some of this money gets back to Kansas. Okay. Pilar from Cake. Pilar. That was Pilar.
No problem.
It's Pilar.
Darn it. My
Good
apologies.
good morning. First question I had was, what specifically have you done to try to reach across the aisle to work with Democrats to try to end this shutdown?
I think I've answered that question several times, but I think if they want to talk about healthcare, fixing it, that we have bipartisan legislation done. I've been waiting for this shutdown to happen. We've got solutions out there that would fix that particular problem. So whatever was holding them up, if they want to work on policies, then I'm glad to do it. And I have been and will continue to work on those policies. But to us, it's pretty black and white that we need to keep the government open. We need to keep the government open, and we need to do that so we can work on these other things. I think that's the challenge. Why would Democrats, these are the funding levels they chose. Just last December, every Democrat voted in favor of the current funding levels that we've agreed to continue. In my estimation, these funding levels are way too high. Again, the Democrats took federal spending from $5 to $7 trillion a year under Joe Biden. They went from $5 to $7 trillion. So I think we've reached across the aisle to say, okay, we're going to continue your levels. These are way too high, but we're still willing to do it. I think those are a couple examples. Okay.
Yeah, can call it.
All right. Well, I'm going to make just a quick couple of remarks here. I think it's important to emphasize it takes 60 senators to pass funding. So we do need some Democrats to come across the aisle. I think that this is a political shutdown, and that Chuck Schumer is running for his political life right now. Even though the Republicans have control of the White House, the House, and the Senate, we still need Democrats to cross the aisle to vote for this. Negotiations. The negotiations have been occurring through the Appropriations Committee, where it's supposed to happen. Chuck Schumer would prefer to negotiate spending levels behind closed doors. That's the way he's always done it. But compliments to our Appropriations Committee, which has 90% of the funding through committee. For the most part, I mean, everyone that they voted on has huge bipartisan support, like 23-2, 24-1. Those need to be brought to the floor where we can vote on them in the light of day and allowed to be offered amendments and finish up the process. We talked about health care to illegals, 2 million illegals the Democrats want to give health care to. We talked about rural health care as well. Those are their big charges and my responses. So I hope I summed them up well for you all. And we're going to continue try to figure out how to get this government back open. Thanks for joining us.